right, it's Tony Ray, Hood Handyman. I'm out here at my ear, nose, and throat doctor, Dr. McGirt's office. About to do my just do a routine checkup. Checking on my UPP surgery. I've had a lot of people still ask me about that. It was a little rough this summer with my ear, nose, with my breathing through my nose. I was taking fluosinate, and I was also taking some saline, nasal saline. Kind of keep everything from me being so clogged up and my nose is a little inflamed. So I'm here today to just let them know. I actually tried to schedule this in the summer. I'm doing all right now because the air is a little bit thicker or thinner, whichever one you call it. So um, now it's October that I'm in here. So, basically I'm just having them take a look and talk to him and, do a regular checkup. He might want to, go in there and um, take a look up my nose, see if I was clogged up or anything, or see how it looks. So I'll let y'all know, to the handyman, and I'll give you an update as soon as I leave. Still here waiting on my appointment. I tell you, that 30-day copay, it sure have went up. But it is what it is. Still here waiting on my appointment. About to get this thing stuck in my nose. I hate it. Look inside my nose. I hate that thing. It goes all the way in your nose. I'm doing this video because I had a gentleman or someone messaged me about my UPPP surgery. And basically, I wanted to check in with y'all, because I'm still getting questions about it. This surgery I had done, several years ago, which is my uvula. It basically was a surgery that opens my airway, reshaping tissue in my throat. I also had a turbinate reduction and a septoplasty, which, basically my septum, my nose, was straightened out here, but my septoplasty. And then I had my turbinates shrinked, and then I had my uvula, all that stuff done, removing tissue blocking my airway. I had my uvula completely removed, and I had my tonsils taken out. I had my turbinates shrunk, and I had my septum, straightened. I've been having a little bit of trouble over the summer, last summer. Actually, I scheduled my appointment. The appointment was scheduled way off, because it was summertime, and I couldn't get in to see the doctor until, you know, recently, like today, and it's October. It's around the middle of October, 2023, and I went in today, and he just, stuck that utensil down my nose, and basically looked in there and said the nostril on the right, my turbinate looked okay. The one on the left, which is over here, this turbinate was kind of swollen. So he said what he would do is he would have me have another treatment, like an outpatient treatment. I don't have to go to the big hospital. He can actually do it at his office. Dr. McGirt, which is my doctor in Rockingham, uh, North Carolina, he basically, when he does his surgeries, he'll usually do his surgeries in the hospital, but he'll do all his consultations and everything at his office, and schedule things. He's one of the hardest working surgeons I know, because basically he has his practice, and he has his surgeries certain days a week. So like, you go to his office, like, he won't even be there but like twice a week, because he's doing surgeries all the rest of the days. Now, I think he even comes like once a week. He's in surgery all the time. But anyway, he said that I can do an outpatient surgery that'll take 30 minutes, where he will, burn the tissue in here, like burn it back a little bit because it's kind of swollen. He'll shrink it and burn this side and do something this side as well. He said he thinks that'll help me out. I don't know exactly the procedure he did when he did the other one, because I was asleep. And that surgery, basically, he I guess he hollowed out both nostrils of the septum. He shrunk them, and then he put the tubes in my nose to keep it open. And this one, I guess, is going to be a little different. He was very busy. Didn't really have today. I thought he was coming back in the office, but then we went to go schedule the appointment, so I didn't get the specifics of it. But I did ask him, was he going to have to stick those tubes back in my nose, and he said no. If he had said that, I would have just been like, just forget it, because that was I guess that had to do with the septum, like straightening this out. I guess you had to have the tube so you don't move it. I guess shrinking it is just shrinking it. So I expect to have maybe some crust in my nose, expect it to maybe drip a little bit or whatever the case may be. But when you're like 265 pounds and you're moving around, it's summertime, it's hot and muggy, and them terminals start to get swollen, you have trouble breathing, because basically the reason why is because the air in the summertime is a little bit more muggy, a little bit more. It seems thicker, but it's probably thinner air, um, technically. But that air, when you're only breathing through your mouth in the summertime, your nose is clogged up, and you're going for walks, you're basically exercising, you're working, you feel like you're winded because you're not. You got to remind yourself to breathe out of your mouth. Most of your breaths are done through your nose. Your body automatically wants you to breathe through your nose and not your mouth, unless you technically are telling yourself in your brain, breathe through my mouth, breathe through. I mean, excuse me, breathe through your mouth, and then you do. So once you're taking breaths and one of your nose are clogged up, first you figure out that I'm not getting that much air. That's what it feels like, especially when you're fat like me. So I'm not saying this to scare you or anything. The surgery's fine. I'm better off than I was before. Here's what was going on before. When I would go to sleep, my nostrils would pretty much be blocked, like all the time. Like I'd go to sleep, I'd lay down on my pillow, and I'd wake up in the middle of the night. I'd take fluosinate. I would take, nasal saline, and I also take cetirizine as well for allergies. But anyway, that's another one. But my nostrils would be completely clogged up, and I wake up in the middle of the night all the time. Here your turbinates are supposed to shrink and contract and expand anyway on their own. It protects you from, catching a cold and breathing in, a lot of cold air and stuff like that. There's a way it works. You can look that up for yourself. You can educate yourself on that as much as you want. Because if you're trying to get this surgery and do things like that, you're gonna educate yourself, I'm sure, anyway. You know what I'm saying? But now I can kind of control it. If my allergies are getting too bad, because I have allergies as well, I'm allergic to everything. So if I take some of the fluosinate, which is like a steroid, it opens up your nose anyway, temporarily. So that helps me as well. But it was clogged up so bad that I was like using that fluosinate more than I should, like a junkie. Like I was, squirting it up my nose like it was like it was cocaine, because my nostrils are so so clogged up. I couldn't get any relief. That's why I had the surgery. And now it's better because at least I'm not like that the whole night. I actually can get into a REM sleep. But before, that was off the table. I could not get a REM sleep like I wanted to. Before, that was pretty much off the table. So now I'm good to go, except, sometimes I go through when it's muggy outside and my turbinates get a little swollen or they start acting crazy. It's a little bit more tough for a fat boy in the summertime. So that's the reason I'm going back to get the second part, done. Which you know, hey, it is what it is. You gotta do what you gotta do. Hopefully next summer I won't struggle a little bit. I can get out here and get wide open, like I usually am most of the time. And that's pretty much it. I don't want to have to do it again. But it's outpatient. They're not gonna put me to sleep. Just some general, light anesthesia. Just I'll be awake when they do it. I don't have to stay overnight. I don't have to have the whole surgery done. I don't have to go under the, on the operating table. I'm up. I can just after that just go home, watch television or whatever the case may be. The first surgery was horrible. They cut your throat. Both sides, both tonsils were gone. They were turning like it was just like an open sore on both sides of your throat. Even breathing in, the wind would make your throat hurt. You couldn't. A spoon of applesauce was too much. You couldn't have hardly nothing. even drinking a liquid, I lost like 15 pounds. You know what I'm saying? Like, that surgery is hell. You know what I mean? It's your throat is on fire. It takes several weeks to even be able to get back to like eating a burger and fry, eating whatever you're eating. You get a little bit each, you know, the first night or two, it's just medicine basically. Then I've ate some baby food. I tried that. It was terrible. I've tried, you know, uh, maybe a week later, 4 or 5 days later, you can get a little bit of fettuccine Alfredo with not a whole lot of, something soft to eat if you can tolerate it. And then over time, about a month from now, you get better. Then you got these tubes in your nose for like tubes in your nose for about a week, right? And then so you got your tubes in your nose, throat's on fire. You're taking some kind of medication, a heavy antibiotic for at least a week, so you don't get nothing infected. And then you're constantly draining. Then you got to come back to the doctor every about a week later, 2 weeks later, get those tubes removed out of your nose. They're basically stitched in there so you don't blow them out. And you're thinking you can breathe out of them tubes for the first couple of days, and then they just get clogged up with gook. And then they finally, your nose is completely clogged up like But then after the surgery, you can get sleep again. You feel better, all that kind of stuff. I just got mine just kind of, kind of just need to be shrunk a little bit. They kind of over time just got a little bit. Now I don't know if I have to go again and again. It's been almost 3 4 years, so since I had to go back. Hopefully, it takes enough off where it's pretty much I ain't got to never go back again, and I can be, pretty much straight. But that's just an overview. Don't think it's a bad surgery. Don't watch the internet. You're gonna survive. You ain't gonna die. If you got having problems with this stuff, with your sleep apnea, it's better than using a CPAP machine, something you got to use the rest of your life. I've been straight for a while, and then I really don't have to go and take this other surgery. The reason why is because in the wintertime, when the air is kind of less muggy and it's less, it's kind of colder air going through your nose, your turbinates don't want to expand that much. They kind of work with you a little bit. But when it gets hot outside and sweats all over your face and you're constantly just sweating and you're hot and all this kind of stuff, your turbinates, you get irritated. Your nose is running, you sweat, it feels, and then, it's hard on you a little bit in the summertime. But nothing is like waking up at night and both your nostrils are pretty much almost closed, and you can't blow your nose because it's not what's there's nothing in your nose. It's just your turbinates are just need to be shrunk. They're just huge, and you're clogged up there for real. Now it comes and goes, comes and goes. I'm all right, but I still want to be better because summertime I tend on trying to get a lot of work done and doing what I do to provide y'all the best videos that I can. And I don't want nothing to slow me down. So I'm gonna let them do a little something and get it over with. But that's just an update. It's Hood Handyman. I'm signing off. Thanks for watching. Please like and subscribe. And I'll give y'all an update after I have the surgery coming up next month as well. Thanks for watching. I'm out. Oh, please like and subscribe. I'm out.